Hi, everyone, and welcome to another live session as part of AHF's 2020 virtual conference. I'm Leah Riley, the Executive Director of the Association for Healthcare Food Service, and I'm very excited to be here today for our live benchmarking Q&A. Hopefully all of you have already watched our benchmarking deep dive, which Julie and Tim and I have provided in the recorded session list. But if not, you can go back and check that out after this live Q&A. So if you haven't done so, please do check that out. There's a lot of really good information in there about our new program for you to check out. I do want to remind everybody before we get started today that we do have some sessions taking place after this. So this is about a 30-minute session, and then we have a 30-minute break, which is a little bit new for us, but we wanted everybody to be able to stretch their legs, get a cup of coffee, and then join us for our live announcement where we'll be announcing the winners of our culinary showcase. Our culinary competitors worked really hard on their virtual submissions, and there were some great videos and great recipes in there. So I hope everybody comes back at 4:30 after our 30-minute break to join us for that. And then just following that, we'll have a celebration with all of our competitors during our happy hour. So I hope everyone will jump onto the happy hour so that we can see you and interact within that virtual setting. And with that, I am going to pass it over to our gold sponsor, Gordon Food Service, to introduce the session and get us started. Amanda?
Yes, thanks, Leah. My name is Amanda Goldman, and I'm the Healthcare Industry Sales Strategist with Gordon Food Service. GFS has grown to become the largest family-operated broadline distribution company in North America, and we are very proud to be a gold sponsor of this year's AHF Virtual Conference. GFS is very proud to also be a sponsor of the AHF Benchmarking Express program. Today, we are pleased to introduce this live Q&A session with our two fantastic panelists, Julie Meadows and Tim Schoonmaker. Julie Meadows has been a healthcare food and nutrition operations leader at The Ohio State University Wexner Medical Center for over 21 years. Julie began her career in practice as a clinical dietitian before moving on to a variety of management roles within nutrition services. Her primary responsibility currently is as Director of Nutrition Services for the Ohio State University Medical Center Health System. Julie is a longtime benchmarker and the incoming 2021 chair of the AHF Benchmarking Committee. Chef Tim Schoonmaker is a graduate of Johnson & Wales and is currently the Director and Executive Chef for Centra Health Culinary Creations. Chef Tim has worked in the healthcare industry for over 20 years. He is also a certified executive chef and certified culinary administrator through the American Culinary Federation. Chef Tim serves as the current chair of AHF Benchmarking Committee and often personally mentors those following the benchmarking program. Now I'm going to pass it over to Chef Tim and also to Julie. Thank you.
Awesome. Thank you so much for that, Amanda. And to get us started, while everyone is thinking of their questions, which I hope you are feverishly typing into our question box in the live session platform, I have high hopes. I'm going to get us started with a question to start with Julie, and then we can move on to Tim from there. Julie, why is benchmarking and benchmarking with AHF's Benchmarking Express program so important for operators?
Yeah, benchmarking is critical, and thanks, Leah.
Oh, there you go.
Yeah, I'm good. Thanks, Leah, for the introduction, and thanks, Amanda. Yeah, benchmarking is critical. If you need to be able to tell your story. So benchmarking helps you tell your story. If you have a new leader, for example, and they might have certain things that are important to them, or maybe they don't know anything about nutrition services and nutrition services is new to them, you can really tell your story by sharing your data with them, sharing key metrics. You can always tell the key metrics that are important to you, but there might be things that are important to them, and you'll have all kinds of great information from AHF system to be able to share with them, those visually and when you meet with them. Tim, would you want to add a couple things to that?
Yeah, and that's a good point. Always knowing your numbers is very important. As leaders, we really need to know where we stand at all times with cost per patient day, cost net of cash, adjusted cost per patient day, whatever it is that's important to your organization. As you mentioned earlier, you really have to know what your numbers are. I can't say how many times I've sat in financial meetings and I'm able to pull out the data and talk through the numbers and educate the finance people, which again, as leaders, we all need to be doing. We need to know what our numbers are and be able to communicate them at all times. And we should be passing this along to our frontline staff as well. Not necessarily all the details, but our staff should know where we stand, because it is an important metric for them to know the basis of our business. Because again, we might be grooming future leaders.
Exactly.
And so, one of the things that we always talk about in benchmarking, or that we hear quite a bit, is how do I get started? And so, Julie, as the incoming 2021 chair, if somebody reaches out to you, how do you get them started in benchmarking?
Yeah, and if you watch the presentation, thank you for that question. And that's a question we get all the time. I think Leah will be able to tell you, and Tim would be able to tell you that the committee gets that question a lot, or people that are looking to start benchmarking. And if you watch the presentation, I talk about making a list. Starting simple. Everyone knows how to make a list. Everyone knows that sometimes you need to start a big project by making a listing and breaking it down into easy to understand things to do. So if you start with a list, break down what you need to put together, where you need to get it from. Some things you're going to have as a department leader, you're going to have them yourself, and some things you need to get from finance or from your organization. And there's reports that are out there that have the information you need. You just need to seek it and work with the right people to get that information. So making a list, figuring out what it is you need to get, and we're here to help you. That's what the benchmarking committee at AHF is for. So we are here to help you get started. So if you haven't benchmarked before and you want to, we can be your mentors.
And
Perfect.
And I'll just
go ahead, Tim. And then we do have some questions rolling in.
I see the questions. It's fantastic. One of the things too that we hear quite often is the survey trips up a lot of our members. In order to start benchmarking, you have to do a survey, and the survey has a lot of questions, but it's important that we do the survey, because that survey then will put you into those benchmarking categories. So by bed size, by service type, what part of the country you're in, there's hundreds of metrics that we use. And so that survey is vital to making sure that when you go in and benchmark, that you're in the right spot, and you roll up to the right hospital database. So just wanted to throw that in there as well. We do have resources to help with that survey, and sometimes that's the biggest issue for people getting started.
Yeah, and you only have to do that survey
once. The nice
once.
thing about that survey is it's just once. Yeah. Julie and I are in the same mindset. It's just the one time, and then you're just confirming it year to year. I mean, if you have major changes, we'll ask you to complete it again with all the upgrades, but it is just the one time for that heavy lift, and that's what allows you to actually benchmark against people or facilities of similar structure.
Right.
Perfect. Well, we do have questions rolling in. My AHF community has not failed me. So the first question, I benchmark using our organization's preferred vendor. What advantage does AHF benchmarking program offer over Action OI, or what doesn't it?
Great question. Would you like me to start with that one, Tim?
Sure. Yeah, you're
sure. Yeah, we were talking about this before we got on.
Yeah, this is a great question. So I actually also benchmark with Action OI as well, and our organization does want us to do that. I will tell you that there's not much more you need. You can do your AHF benchmarking and your Action OI benchmarking at the same time every month, pull the information together, and you just need a couple more points for the Action OI benchmarking that you don't have for AHF. However, one of the great things about the AHF benchmarking is that it's in real time. So you can get that information. It's monthly. You're entering that monthly. With Action OI, you're doing it quarterly. And so you have more current, real time, right now data. So if somebody from your leadership in your hospital, your organization wants information, you can log in right away and get it immediately. So that's one of the best benefits versus a system that is quarterly. And I also think Action OI is very heavily labor focused. I mean, that's what it's really around, is productivity and labor. And AHF benchmarking gives you more information from my perspective. And I've used that. I've done both for many years, and I just feel really like the fact that it's real time and quicker information from AHF.
Yeah, and I would agree. So we also use other systems besides AHF benchmarking. So a lot of times we can kind of compare them all together on spreadsheets. So at the end of the month, when we do our monthly reports, we'll go ahead and add some metrics to our database, or to our dashboards rather. So that way we can see where we're at real time. And that is the main difference, is that our system is real time. We have one that we use here that you get the data the following year. So it's hard to make adjustments and improve your metrics when the year has already passed.
Great, thank you guys both. So the next question that we had come in, and I'll have Tim start with this one. Once you're set up and you figured out where all of your data comes on a monthly basis, how much time does it take typically to complete the benchmarking process?
So it depends on how fast you can type. If you're really good on the keyboard, you can probably do it in a matter of minutes. The bulk of the work comes from gathering the data. And so I know Julie and I talk about this all the time. You know, benchmarking is our lives, so we talk about it quite often. And we have these mega spreadsheets that we use, and some are really simple and some are pretty complicated. And so that's the bulk of the work, is really getting the data together and putting together your numbers. Once you have them and enter them into the system, it again takes minutes, but then you can spend as much or as little time as you want pulling reports you would like, graphs and pulling from the database and that sort of thing. I know there's other questions on that we can touch on when we get to that point, but Julie, if you want to add anything to that.
Yeah, the only thing I would add there is, and when I was first learning to do benchmarking, I think it took me, I'll be honest, it took me a little bit more time when I was learning from my mentor. And, you know, I had to make sure my data was right. You know, that's very important. You want to make sure you're pulling the right data and you're following the definitions so that we're all on the same playing field. So that's important. So it can take, you know, it can take you a while. The most consuming time is, like Tim said, putting that data together, but it doesn't take anything more than a minute to actually enter your data once it's done. I'm not sure if the question was more of, I have all the data together, now I have to do all the figuring and figure out where it goes. That's where that big spreadsheet for us comes in. You can either do it by hand or you can do it on a spreadsheet. And I got to tell you, I have a love-hate relationship with both sometimes. My spreadsheet gets a little complicated, and if I mess up the wrong formula, then I want to make sure that's correct. But you can do it by paper, and then you can see your work too. So there's multiple ways. It depends on what's important to you and how you like to do it. If you have a really complicated organization, I recommend that you use the spreadsheet, because it does help. It helps clarity, and you can see everything, and you can make sure your formulas are right as well. So, yeah.
Great. So another question from the group, and thank you both for that. What data, and I'll start with Julie for this. What data should I share with my finance and administration teams? What is the most important set of numbers that I should be sharing?
So that's probably different for different people. So it depends, like I said originally, if you have a new administrator or administrator that likes certain data from a nutrition department, then you're going to want to focus on those data points, because you want to ask them what's important to them. In our organization, we look frequently at cost net of cash per patient day. We look at other metrics related to our retail transactions. We're looking at our number of meals per patient day. It might vary, because a different leader that comes in might have something that they really want to see, if that's your cost per patient day. And Tim might say, well, at my organization, we look at these specific metrics. It could be different for everyone. That's what's beautiful about AHF benchmarking, is it gives you everything. And you can look at it by meal, you can look at it by day. You have so many different metrics that you can look at. It's almost like, we've talked about it on the benchmarking committee, it's almost sometimes more information than you need. So you're trying to figure out what's the most important metric. So we could certainly talk to you, but I would encourage you to also talk to your leader about, when they think of nutrition services, what's that metric that they think is most important for you to follow and monitor. Because the other thing about benchmarking is benchmarking yourself, like internally. Yes, you can benchmark to compare yourself to others, but one of the things I do it for is to benchmark our internally of myself over months and period of time. So there might be a metric that we always want to keep an eye on, and there might be a metric your leader always wants to see. I don't know if Tim might have different standpoint there.
Yeah, I mean, it's almost the same thing. It does vary depending on what is important to your organization. And in some cases, it may not be on the radar at all, right? So what a better time to be prepared and have everything ready. One of the cheat sheets that I always use, and kind of one of the leading practices for benchmarking, is to be able to, when you look at your numbers, and so I'm just going down the list here, we have labor per patient day, labor per meal, food per day, food per meal, supply cost. If those numbers are high, you can hone in on them and learn or decide how you're going to start to bring those numbers down. So for example, if your labor per meal is really high, maybe it's an opportunity to look at your staffing. It's probably not the best one to choose. I'll roll with it since I started it. But yeah, maybe if your metric is really high, so you're spending a lot of money per meal, is there an opportunity there to look at additional meals, or maybe look at a takeout program, or look at moving some staff around to different areas, or even, God forbid I say, downsizing a little bit, but during the pandemic, that was one of the things we had to do because our labor per meal cost needed to stay at a certain point. But even net cost per patient day or net cost of cash, you can narrow in on those and look at opportunities within your areas to increase revenue, or look at offsetting revenue in certain places. Maybe it's community outreach, or something that your department's able to be reimbursed for. I know another hot topic is always floor stock. So maybe you look at your floor stock cost, and if it's rather high, or is benchmarking high, maybe you come up with a plan and start knocking that down a little bit before somebody comes in and tells you your numbers are out of control. So all of these cheat sheets we use are all on the website as well. And we refer to them quite often. When we're reaching out and mentoring people, we always try to get those out and forward first, because they're fairly simple to understand, and it helps us go through the system with the operator and understand it.
Yeah, and we do produce an annual report, which does have, I think it's 6 sort of high-level metrics that we consider to kind of be, high-level primaries. In addition, they are also folded in, but that's in addition to the 30 KPIs that we provide throughout the system that you can pull at any time. But that's also a good place to start. If you're logging into the benchmarking program, you can actually pull that report within the system and take a look at that. And that's a good report just to reference at a high level, and then start benchmarking, and you can start to dial that into more specific areas as well. So that's definitely a really good reference point too. Okay, so I'm gonna have Tim start with the next question. What are some of the new, this is sort of a big one, so maybe we want to pick a couple high-level ones. I know there's more information within the demo, but definitely some good things to highlight here during the Q&A. What are some of the new enhancements in the program that members should take advantage of?
I'm going to steal the one that I like the best, and it's being able to, when you log in and you go into your individual report. So for example, I have 4 hospitals, so I'll just choose one hospital and go into it. And let's say I want to look at what my benchmark number is for cost per patient day. I can pull these really cool looking graphs, and I can change the graphs based on however I want to view them. And so I can actually take those graphs and clip them and put them in a financial report right from the system. And so that has been a really cool upgrade to the system that I've taken advantage of quite a bit. And it's just an easy way to look at your numbers and where you fall within the percentile ranking, or scatter plot, or whatever you decide, however you want to look at it. But that's been a really cool way to look at the numbers.
Yeah, and I would add that I really like that the graphs, if you are comparing yourself to other organizations, you will see where you should be by color. So it's very easy to understand that I should be where you should be compared to, red and green kind of tells you, and I'm going to call it, green is you're doing great, and red might be your opportunity. That might be that floor stock, or that might be labor, depending on what you're looking at. But that is an opportunity for you to say, okay, where am I red? Where am I close to the red line? Where should I make some adjustments here? And then to look at your trend line, I agree, looking at how you've trended over months. So we might have, all of us probably looked really different in February than where you looked in March and April and May and June, depending on geographically where we are in the country. We probably had some different look on our trend graph for sure over a period of time. So that's really helpful to look at the whole year and be able to export that easily out of the system and print it and have it ready to go. I think those are all great benefits. There's probably 100 more, but those are some of them.
Yeah, the nice thing too is that the reports print out with the name of your facility on it. So it's a little bit customized. You could print it right out and hand it off, and it kind of looks like you created a customized report for yourself. And that was a feature that we really looked for when we were doing this as well. It does have a lot of functionalities. I know a lot of people have told me too that the sort of self profile within the system holds all of your data that you've entered. Really does kind of all of your data lives and is housed there. So it's kind of one point that you can go back to get it all back again. Perfect. Well, thank you guys for that response. So another question from one of our members. To the point of self-auditing, we have 12 facilities. Can we create a compare group that is only our facility so that we can benchmark against each other? And I'm going to take this myself, just system-wise. I'm self-assigning. We have the capability to do that. That's actually something that we have talked about with our provider. The nice thing about the system is that we are constantly providing updates and doing different things within the system. So there's two ways. One would be a little bit down the road where we could kind of create a specific filter that you would be able to use for something like that if you were a larger system. But in the meantime, if you're a system level administrator, you can also have access to all of your facilities, and you can log into each of those facilities and pull reports and do a comparison from that perspective. You can also filter by location. There's a lot of different ways that you can filter, but definitely something down the line, that we'll be able to kind of spool up is a filter that you could use to say, I want to filter against X facilities. And that's something that you would fill out in the demographic profile, and that would allow you to benchmark just against your own facilities. But in the meantime, you can use the reports to pull that content and that data, and system level administrators, can have access to see all the data for all of their facilities. So we can definitely set that up for you guys on a separate basis for the system level benchmarkers. All right, and there's another question in here. How many members are participating in the benchmarking program, and is it enough to make the results valid? So I will let Julie start with this one, or I can take it.
Well, and I don't know Leah, you probably know the exact number, right? It's different. We look at it in our benchmarking committee every month. We look at how many people have benchmarked, and we get that report every time. I will tell you, I'd like to see more people benchmarking, but I think we have a pretty good number. Leah, what's the exact number that we are ish or average, or maybe Tim knows? I don't know.
Right now we're, on average, we're between 120 and 150 facilities on average. We do have people who are still logging into the new system. So that is a number that has been increasing steadily. And I know what I've heard from people is as soon as they log in and realize capabilities and how powerful it is, and that's a little bit easier to use, they're pretty hooked. So, but definitely I agree with Julie, and I'm sure Tim would echo that, and I'll let him echo it. But every person that benchmarks is more data and more people to benchmark against for you and for everybody else. So the more people that benchmark with us, the more data that you have, and the more data that we have to also, disseminate out to the larger community.
Yeah, I would agree. The more, the better, and the more data that you have, and I think it's just one of those things that sometimes as directors, leaders, managers, professionals, we have to kind of push ourselves to do certain things. Our days are busy. We have a lot going on. So, I don't have time to benchmark, or I don't want to bother benchmarking. But, really there's a lot of advantages of being able to pull numbers and do some self benchmarking versus, relying on somebody else's system. At least what's going into it. So, we kind of have to just push ourselves a little bit and get ourselves set up, and then just make it a routine to go in every month and update your numbers after you get your numbers from finance. And just make it a best practice. That way we have a pretty robust system. And, I, along with Julie, have been benchmarking for quite a while, and, sometimes change isn't easy. And so we went a couple of months without benchmarking as we transition systems. And so when we came back up to this one, it was a slow start, but now we're starting to see a lot of good progress. And, we just want to encourage everybody to really move forward and get their numbers in. And, let's build a very large database here that we can all use.
Absolutely.
Mm-hmm. Great. And the next question, I will start with Julie for this one. What about new operators or new benchmarkers? What is the best advice for helping them to gain confidence within the system, as well as within their data? And then, this is a three-part question, and then how to report that data to their boss. So I guess just confidence overall. And I might tie this to the question after it, which is kind of asking about, how to get a mentor and that kind of a process, because I know that will be part of your answer as well. So I'll fold them together.
Yeah. So I'm trying to remember all the parts, but I think, yes, we can provide a mentor for you. For new operators, you just need to get started. So it's not, don't look at it as an overwhelming task. If you're new and you've never done it before, it's not as hard as you think. And we can help you do it, and we can help you get started, and you have a mentor in all of us. We can help you get started. So that's really a big part of that. We also, we're hoping as a benchmarking committee to reach out to people to say, how can we help you if you haven't benchmarked, or maybe you benchmarked for a while and then you stopped and you haven't benchmarked in this amazing new system, and you really absolutely should, and you'll be amazed at how easy it is to use and how much information you have at your fingertips. So, we're going to encourage you to get in there, get set up, and then reach out to us if you need help. If you're confused about what data points you need to pull or what information you need to pull, we want to help you. So does that answer the question, Leah, or was there another piece I missed in there?
No, I think that answers the question, just in terms of gaining confidence as a new benchmarker, or maybe even a new operator and director within the field as a whole. Tim, I don't know if you have more to add to that, but I know one thing I would told me that the program provides you with that confidence too.
Yeah, I was just going to say, I missed that part of it. One thing it adds is if you're benchmarking, you're going to gain confidence because you have that data. You're able to tell your story, your information, your numbers, and you're going to get confidence just from knowing them, right? So just from building that information. And otherwise, you don't know those numbers and you don't know your data, and then that makes you very unconfident. You can be much more confident with the information, but I'll let Tim jump in here too.
Well, and also just to add to that, if you're afraid of making a mistake and making the numbers look crazy, we have high and low metrics built into the system, which will kind of give you a warning if something's not right. So if you're entering a crazy high number, it's going to pop up and it's going to say, hey, check your number, it's not right. And, maybe you hit the decimal point wrong or hit the wrong and added an extra zero. It gives you that warning so that you don't have to worry about, oh my God, I'm going to screw this up immediately. So over time, going into the system and making it regular really helps you gain the confidence. And, and just to add, in reporting to your boss, I came out of a health system years ago before I joined AHF, and these numbers were always done for us at a higher level. So by the end of every week, we had a deadline. We had to get our numbers into the system. And then I don't know what they did with them, but then these fancy reports popped out at the end of the month, and you use those to report out, and you didn't really have much control. So when I started benchmarking, which is something we had done, I stepped into that role, it was made pretty clear of these are the metrics that we need you to report and work on. And so, over time, I had to learn and gain that confidence to be able to pull those reports and know that what I was doing was correct. Did that being able to get through with a mentor and really understanding the system. Apparently I did so good, I became the chair for this year. And just kidding. And, being able to report those numbers and be confident is a huge point. And it comes over time. You just have to know that what you're doing is right and practice, and then you ease your way into it.
Awesome. And I think last question that we'll take, and then we'll wrap up so that people can take a bathroom break and grab a drink before our session at 4:30. I think that the fear that some people may have is the task of finding the data for the input. What suggestions do you have to reduce this fear? And I will start with Julie.
Yeah. Again, I'm going to go back to making a list and figuring out what exactly you need to get and where that information comes from. So if you watch in some of our presentation that we did, the recorded session, we kind of laid out on one of the slides some of the department generated information and some of the finance or the organizational information. So you always want to get a financial partner. You want to find that partner in your organization that's in finance that can help you. And believe me, if you reach out to them and you want to gather that information, you tell them what you're doing and what you're trying to do, they're going to help you. They're going to help you find that information because they're going to be impressed that you're benchmarking, comparing yourself, that you're looking at your numbers, that you're understanding your operation, and that you're trying to improve it. So, get that partner in finance. Find out where these department reports, you might already get the reports automatically and some of the information is in there. Some of those reports can be overwhelming sometimes and you're not really sure where it is, or maybe you can access it on a shared drive or something like that that's already out there. So it's just starting to ask some questions about where some of that information is, such as patient days, some of your performance report information each month. So we can help you if you have a question about which data point you're trying to gather. Should you have that or should the organization have that?
And I would just add, I would just add, get yourself organized. Sometimes that's the biggest hurdle we have. We procrastinate and push things off as far as we can, and then you are unmotivated to do anything. So just get yourself organized, understand, you can log into the system and look what those numbers that you need to have. You can look at the recorded session that we did, or you can go on to the website and you can pull all of the help documents. There's also a recorded session on there. And once you have that information, maybe it'll give you some more info, start to figure out how to build that data or gather the data, as Julie said, whether you have a finance friend or you have a monthly operating report where these numbers are already there. It's just a matter of putting them in the system and then learning what reports you want. So just get organized and ease your way into the system.
Great. And I don't want to keep people too long, so I'll maybe just let Julie and Tim each kind of say a final word about why they think benchmarking is so important. And of course, we're here for AHF's conference, so why AHF's Benchmarking Express program is so important. Julie, I'll let you start.
Yeah, I think you got to be able to tell your story. If you watch the recorded session, I think you'll see how many tools that the AHF benchmarking gives you, and at your fingertips. All you have to, you enter that information and then you have so much data to work with and choose what to do with. So you'll be able to tell your story, you have your numbers, you'll feel more confident in your ability to understand your operation, but also you'll find those areas where you need to improve. And you'll find that low-hanging fruit maybe of things that just, hey, I didn't even realize that was an issue. Now I know that I can fix that. And then if you do action OI benchmarking or another thing, you're going to look better on those reports because you're looking at something real time right now as you enter each month, and you're ahead of it. You're ahead of the game. You're being proactive and not reactive to a report that your leaders send you and say, what's happening with this? And if you should already know. You should already know what's happening. So if you look through the recorded session, you'll also see some quotes from some of our AHF leaders, past leaders, benchmarkers, for some advice on what they have done over the years and why this benchmarking is important. And it's great advice. It's really something you need to do, and it's free. It's free. It's a free resource for members. So can't be more of a commercial than that. Nothing's free usually. So this is great.
Yeah, and I'll add in too is that, you know, I spent most of my career working for a contractor. And so I can tell you that some of the tactics that are used is that you sit and build spreadsheets based on numbers that the client or the hospital might want you to have. And so you kind of fill out the spreadsheets and then you back into them in the best way you can. And so sometimes that means you as the operator have unrealistic expectations trying to meet those numbers, or sometimes you know, the facility can be awestruck at some of the, or starstruck rather, at some of the numbers and how great they look, knowing that, you know, you're going to have to figure it out. So for benchmarking, they come with their own loaded benchmarking system, and the numbers may not make sense, but then again, who might ask, right? So it's important that we have our numbers up to date. I'll tell you that this is the time of year where most of their fiscal years are ending or beginning. And so a new year means new goals. And so they'll be out and about trying to get whatever business that they can. And of course, numbers always speak volumes. So have your benchmarking numbers loaded, have them ready to go. That way, if somebody walks in the door and says, hey, we have a company here that can hit these patient day numbers, cost per patient day, you know, why should I not go with them? And you can say, well, because ours are twice as better, and we have this, and we have that, and we have fully loaded and vetted numbers. So you don't want to wait for that to happen. You want to be prepared. You want to have those ready to go. And you really want to be able to just fend all that off from the very beginning. So it's much easier. It's like when the Joint Commission walks in the door, you don't want to scramble and try and get all your stuff done. You want to have it done and ready to go. So you're just handing over documents and saying thank you and have a nice day. So
oh, sorry, I muted. Thank you both, Julie and Tim, breaking my own cardinal rules today, for this awesome session and for chairing our committee. I know that you guys and the whole committee do a lot of work to continually add improvements. You know, one thing I will say is that we get emails from members all the time. Hey, could we do this? Could we do that? Those are things that we take into account, and often we implement those recommendations. So we make changes and updates all the time, and we're consistently adding new functionalities to the system. You know, we have a roadmap of sort of longer term things, but we add small things all the time and make adjustments. So we're continually making it better. So thank you guys both for being experts and for joining us today. I just want to remind everybody before we sign off that we do have another session at 4:30 in 20 minutes. So please do sign back on to celebrate our culinary competitors with us for the Culinary Showcase. We'll be announcing the winners of People's Choice Award as well as Best Video. So I hope you guys will join us for that, and then also hope you will join us for the happy hour. And with that, I'm going to sign off and thank everybody for joining us today. I'll see you guys in a couple of minutes. Thanks so much.